You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, laser vaginal rejuvenation. My advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Elliot Lander. Dr. Lander is a board-certified urologist, fellow of the American College of Surgeons. Dr. Lander has experience with cosmetic and pelvic floor reconstructive surgery. He is here today to discuss laser vaginal rejuvenation. Dr. Lander, welcome on the program.
Thanks, Randy. Thanks for having me.
Now, before we get into today's topic, tell me a little bit about your practice. You have a well-established practice in Rancho Mirage, California.
I've been a urologist for 22 years, and I've been in this valley for 11. And over the years, I've developed a special interest in pelvic floor reconstruction. I also have some unique experience with lasers in prostate and bladder surgery, and I was one of the early pioneers in the 1980s in the use of lasers in urology.
Okay.
So my interest in the use of lasers in pelvic floor surgery has evolved.
What about your background, training?
I grew up in Los Angeles, and I went to Occidental College, and I did my medical school training and my urology training at UC Irvine.
Now, why does somebody become a urologist? Did you know right away this is what I like to do?
Urology, at the time that I was searching for a future, I felt like urology embodied the future. We had access to new technologies. Use of microwaves, radio frequency, lasers were commonplace in urology. I saw some of the other fields stagnating, using some of the same technologies, same surgeries, same type of themes over and over again. And in urology, we were starting to develop new methods of minimally invasive surgery, including robotic and laparoscopic surgery. And there's a lot of variety. We take care of women, we took care of men, we took care of children, we took care of healthy people, infertility, cancer, all kinds of problems, erectile dysfunction. And so there was a lot of intellectual stimulation and a lot of choices, and I thought it would be a great fit. In my practice over the last 11 years, I've emphasized pelvic floor reconstruction. I've really enjoyed it.
And what is that? I mean, it's for urinary incontinence?
In many cases, it's for incontinence. There are major structural defects that women suffer from related to hormonal influence, genetics, childbearing age. The pelvic floor weakens, and patients often form what we call pelvic floor hernias. And often their bladders or other organs, bowels, rectum, can fall into these spaces and create a lot of problems related to which organs fell. For example, if their bladder fell, they might suffer from incontinence. If their bowels fell, they might have pelvic pressure. If their rectum fell, they might have problems with, defecation. And those pelvic floor defects are repaired surgically by placing mesh, and there's various technologies for repairing them.
You performed over 4,000 genital surgeries. Is that true? Is that
female genital reconstructive surgeries? Yes, Randy.
Okay, so why the transition from standard traditional urology to this laser vaginal rejuvenation?
More and more, my practice is focused on the pelvic floor reconstructive surgeries. And with my special interest in lasers, there was a professional attraction for me when I learned that you can use lasers in pelvic floor reconstruction and, in addition, add a cosmetic component. Okay,
now today we're going to be talking about, and we've talked a lot about this off camera, and so the first half, I guess there's the aesthetic procedures with the laser, and then there is a tightening procedure.
Right.
Is that right?
Yeah.
I mean, are those the two categories?
You could separate what I do into two categories, but generally there's the laser vaginal rejuvenation, which is a type of tightening procedure. And then there's the designer laser vaginoplasty, which is more of an aesthetic procedure where we can sculpt the external genitalia to the patient's specifications.
Okay, let's start then with the tightening procedure, and then we'll move on to the other. How big of a problem is this?
It's a real problem, Randy. It's real. When I first started doing this, I was intellectually interested in it, and I wanted to learn the cosmetics, I wanted to learn the laser procedures, but I didn't really understand what I would be dealing with and what I would see out there. But as I'm talking to women and doing more of this and out there.
Because you're seeing this in your regular practice.
Well, in my regular practice.
I mean, complaints of this.
Patients would make comments from time to time, but as I became more involved in this, I'm hearing things differently. I'm hearing things from a different perspective. Women want to be heard. They want to talk about these issues, and I think they're embarrassed to, especially, you know, over the years when they come in for a little bit of bladder work or something related to a hernia, pelvic floor hernia, or incontinence. I think they're, frankly, you know, having a hard time discussing it with their physician. And I'm talking to colleagues of mine who also do laser vaginal rejuvenation in other cities. I'm hearing the same thing. The patients have been looking for an avenue to have a safe place where they can discuss this.
What do you call it? I mean, is it vaginal tightening? What do they call it? Is there a term for it? Because this isn't new, you say.
It's a modification of a traditional procedure called anterior posterior repair, which has been done safely for nearly 75 years.
Okay.
What's new is the technology that's brought to it, the new laser technology, which makes it essentially bloodless surgery, cleaner surgery, fast healing, just, you know, more modern surgery, and some cosmetic techniques which were previously never really performed on that part of the body. You know, they were always reserved for face and, you know, other areas of the body. And this marriage, this incorporation of all of these different types of different technologies creates really a new surgery.
Okay, who is a candidate for this tightening procedure? Is it women that have had a lot of children? I mean, what are the different categories of patients you expect to see and that you're seeing?
You know, if you ask women who've had a lot of children, they often will complain of this. Often they'll tell you that they have already complained about it to other physicians, to their gynecologists over the years, and sometimes they'd get a patronizing comment, or it would be poo-pooed, or someone would pat them on the back and say, you know, sure, that's part of getting older. Oh yeah, that's part of having kids. But in reality, the patients are distressed, and they are unhappy with how things feel and how they changed. Very commonly, childbirth causes this. Sometimes
Okay.
just aging process, and actually sometimes, Randy, it's genetic, it's familial.
So the typical patient that you see, younger, older?
Randy, although most patients are between 20 and 50, we don't really have a typical patient. There's a lot of different reasons why women feel they need to see a physician to discuss this problem. We have younger women who might have a little incontinence and then maybe are unhappy with the appearance of their external genitalia.
Okay.
We have some middle-aged, a little bit older ladies who've had a lot of kids. We have women in their 30s who are married and noticing some changes that are, you know, maybe it's interfering with intercourse. Dr. David Matlock, who designed these procedures and created the procedures and taught them to me, he realized that the sexual gratification is related to the amount of frictional forces generated during intercourse.
Now, I've been told, though, the problem with this procedure, or procedures like this, I should say, lack of sensitivity for the woman. True?
It's a real issue. The
Okay.
one thing all the patients have in common is that they're bothered by
lack
this.
of sensitivity after the procedure is my point.
No, we have not seen that, and especially if it's done properly and you use the laser.
But isn't that the problem, that you lose sensitivity? It's scar tissue.
I could see why you would think that, but in reality, you don't lose sensitivity because you're cutting cleanly with the laser, and that area of the body heals extremely well. It's very similar to your lip. When you cut your lip, it heals rapidly, and there is no loss of sensation.
Do the women say that they have increased, I guess, pleasure during
reporting-
intercourse? We're talking about intercourse at the moment.
They're actually reporting improved sensitivity because
Is that
you have
right?
that contact. You're creating that contact that allows for a sensual experience.
This is a tough topic to talk about. You know, we discussed, and I had to think, you know, long about
It's a
should
tough
this.
topic not to talk about because people are just ignoring it, and there's a lot of people out there who need help, and they need to have a place where they can feel safe to talk about it.
Women, they call. They must feel uncomfortable talking to a male about this.
Sometimes at first, and then it's
When
okay.
they call in, who do they speak to?
When you call our phone number, you actually speak to a woman, and
Okay.
You get a compassionate voice. There's someone who talks with you a little bit.
This is a very sensitive subject, tightening, vaginal tightening procedure. I mean, do they want to talk to a man about this?
At consultation, the women that I've seen are very happy to have someone who's willing to listen to them
Okay.
and address the issues, because these are real issues for them. These are issues, whether it's the aesthetic issues, which we'll talk a little bit more about in a few minutes, or some of the issues regarding vaginal relaxation, which is the loss of internal and external diameter and tone and muscle strength. Those issues are very real. They can cause a lot of pain and a lot of a loss of self-esteem for these patients.
Now, the new procedure with the laser, why is this better than what you've done in the past?
Well, now we've taken it to the next level. We're using a laser which causes nearly bloodless surgery, rapid healing, minimal pain, and excellent outcomes. And we use this diode laser in a very specific fashion to give you a better outcome.
How was it done in the past, by the way?
There's a number of ways it was done, mostly with a scalpel, and it was traditionally a fairly bloody surgery.
Okay.
And there was little attention paid to restoring the perineal body and apposing the tissue planes the proper way so that you can rebuild the perineum and the introitus. And it was more functional without an eye towards cosmetics.
Okay.
And also it was more just, bring this tissue to that tissue and quickly whip stitch it together. A lot of the techniques originally were based on some of the repairs that were done after complex deliveries. And there's no room for that anymore.
Is this
it's a different generation.
Is this a tricky procedure to do? Technically demanding, I should say, for you as a surgeon?
Actually, it is. You have to have experience with pelvic floor repair. You have to feel very comfortable operating in that area, and you have to have a fair amount of experience and special training to understand what it is you want to do and why the laser makes a difference and how you use the laser. I don't think that this is something that people can figure out on their own just by hearing that some other guy used a laser, so they're going to use a laser too. There's very, very specific techniques that make a big difference.
Is this gimmicky? I mean, is this something that's
absolutely not
kind of hot right now? And because somebody said that to me. They said, Dr. Lander, mainstream physician. I mean, you're an established guy. Your wife is a radiologist, we should mention, that I've had on the show. Works with breast cancer, early detection, et cetera. Were you worried about your image going into this?
No, absolutely not. And you asked if it's hot or gimmicky. It's not gimmicky because you're fulfilling an important function. It's real. You're making people better. You're helping people. But is it hot? Yes. And it's hot because anytime you touch a nerve, anytime you focus on something that's been there all along, but a lot of people have ignored and don't feel comfortable with, then yes, it's hot. And
so if it bothers them, your feeling is you could do something about it. That's why I felt this was potentially a good show, because I didn't know it was a big deal. You're saying this is, something women face.
It's not for everybody. I think I'm here really getting the word out. I'm not promoting this as, I'm going to market this procedure and I believe everyone should look at it. Absolutely not. The people who know, I should say the people who have this problem, they know who they are and they've known for a long time. And all I want to do is let them know that if they want it done and they want it done safely, ethically, and professionally, there's a place they can go.
Is it safe? Is it safe?
Absolutely, it's safe.
You say the old one was virtually or bloody.
It could be potentially quite bloody.
What about downtime with this one?
With this surgery, you have about 5 to 7 days off, and you need 4 weeks of no intercourse and no heavy exercise.
Okay, but for the most part, the process, how long does it take you to do the surgery?
It's actually relatively minor surgery. It's an outpatient surgery. It takes 1 hour. And patients go home the same day, and this with oral pain medicine. It's not extremely painful because we do something called a pudendal block.
Okay.
And that takes care of most of the pain for the first 24 hours. After that, the pain is just mild.
And what about insurance companies? How do they view this type of tightening procedure?
Yeah, I think someday they might address this. It's new, and unfortunately, most of them don't really recognize it as something that they would reimburse for.
Right, and we've talked. It's not a lot of money to do this. It's reasonable, less than most cosmetic procedures. Do you look at this as a cosmetic procedure, a tightening procedure?
There's a functional component to the tightening procedure. For example, a lot of patients are able to now enjoy intercourse and they couldn't before, and a lot of them have a little bit of mild incontinence, and this procedure takes care of it. So I don't think it's purely cosmetic, although we do use cosmetic surgical principles in the surgery. Maybe more on the cosmetic spectrum would be the designer laser vaginoplasty surgeries that are offered. And if you go to my website, you can see that there's a menu of many, many different types of procedures. But
yeah,
again,
I looked at your website.
Yeah, the two main categories being the tightening and then the cosmetic. But in the cosmetic procedures, which is the vaginoplasty.
Let's do this. Let's take a quick break. I have to take a quick break. We come back. Let's talk about the aesthetic part of this topic. You're watching The Wellness Hour. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, laser vaginal rejuvenation. With us we have Dr. Lander. safety. So we're talking about the tightening procedure. We're going to move on to the aesthetic component here. It's safe.
These are safe procedures. There's always risk associated with any surgery, even a minimally invasive minor surgery, even an outpatient surgery. But we take a lot of precautions to protect the patient. The patients have a very low risk of bleeding or infection. Okay. It's much lower than 1%. And it's, you know, compared to a lot of the surgeries that urologists perform customarily, this is considered a minor
painful.
surgery.
Sounds very painful. Do they report pain? A lot of pain?
Very mild pain. Oral narcotics are adequate after this procedure.
Okay, now what about the sedation process while they're having it done?
You know, you can use almost any anesthetic. You can use regional, which means from the waist down. You can use a twilight. You can go to sleep all the way, which is a general anesthetic. You can use local. 98% of patients are having this procedure done around the country using general. It just seems to be the fastest, easiest, safest way to go. And you know, there was over 1,000 of these procedures performed in the United States last year.
Now, what about Kegels? Why not just do Kegels?
Kegels
for tightening.
Yeah, patients are reporting, especially after childbirth, or sometimes it's familial, but they're reporting a loss of sensation and a loss of contact. Kegels mitigates. They only help so much. And the patients I'm seeing have failed Kegels. They've tried Kegels.
Tried that.
And a lot of times when they have complained to their physician about this problem, they were just told to do Kegels over and over again. And you know, they want to address the problem in a more fundamental way.
How does somebody know they're a candidate? They're watching the program. At what point should they do something about it? Do they wait for symptoms? What is it?
Well, it's not a disease process that could lead to, you know, dreadful consequences if you wait. You know, what we're hoping for is that patients who are feeling that there is a change, that they want to do something about it, we're hoping that they feel comfortable picking up the phone.
So it's affecting their sex life.
Absolutely, yeah. And if they're sensing that, if they know it, sometimes their partner might say something. And now, you know, I want them to just be able to talk to someone about it.
Do these women have a tough time holding their urine, for the most part?
There is approximately 20% of the patients have some degree of stress incontinence. Stress meaning like when they cough, sneeze, exercise, or laugh, some urine actually is lost. And it is taken care of by the procedure. All
right, okay. For the sake of time, moving on to the aesthetic portion of this, rejuvenation. Who's a candidate?
For the designer laser vaginoplasty, women are coming in who are unhappy with the appearance of their external genitalia.
Okay.
Some women report that the labia is too thick or too wide, or it spreads out past the labia majora, and it really bothers them. It bothers them.
And is this one of those things that's a big problem? I mean, is this a major complaint that you hear about in your own, you know, mainstream practice?
You know, it's not a major complaint. It's not a major problem in society. But for the people who do have that problem, it's a major personal problem.
Okay.
And they, for example, might have shame. They might not want to be sexually active, or only with the lights off, or you know, maybe they don't wear certain types of clothing or certain bikinis. And in some cases, it interferes with intercourse. The shape and size of the labia actually interferes with intercourse. And you know, women are talking about it. And I think it's important to be able to address it.
Now, you have pictures that we would not allow on the show that are on your website.
You know, if you go to my website, Randy, there is a few before and after photos just to give you an idea of what we can do. Actually, women sometimes come in with a photograph from a men's magazine, Playboy, or you know, one of those type of magazines, and say, "I want to look like this."
Well,
in fact, some of those models have had this type of modification.
Can you duplicate things like that?
Absolutely.
Is that right?
I mean, you can create any appearance to the patient's specifications, but it has to be done right. You know, people who don't customarily do this surgery and aren't trained by Dr. Matlock and have the special techniques, they think that you just take some type of cutting device and cut off redundant extra tissue. It's not that simple.
But are we talking about that? Redundant extra tissue? Just large tissue, exaggerated tissue that you are taking off with a laser? I mean, is that what this procedure is?
You know, that's the essence of it. But how you do it, you know, that's really
plays a role.
That's really the big difference.
A loss of sensitivity, and I told you that on the phone. It seems like that's the complaint I hear from other doctors that don't do it, but they say I'd stay away from it because of the lack of sensitivity.
You know, it's important to be careful to do the surgery properly, and if you're not experienced in it, you might run into problems where you can create some nerve injury or you know, some damage to a vital structure. One of the things we do when we do, for example, a reduction labiaplasty, which is the most common vaginoplasty, is we also reduce excess prepuce, which is the skin around the clitoris. You have to know how to do it. You have to be careful not to damage the clitoris or even come near the clitoris. But if you don't do it, you get an asymmetric appearance where there's extra tissue up above and then the labia look trimmed and it looks frankly abnormal, it looks funny. At the same time, you have to pay special attention to the perineum, which is the area just below that. That's a very important structure, and it has to be integrated into the repair so that there's symmetry, so that it looks right, and it's, you get a good outcome. You can't just, it's not as simple as just, cutting away something excess. That will certainly lead to some
You think even in the medical community
outcomes.
that's the perception as well? Like you say, it's not just about cutting away the tissue, extra tissue.
This whole procedure is so new for the medical community that there's controversy. And I think, if you look back 30 years ago, there was controversy when breast implants came out, and people were saying, well, why would anyone stick something in someone else's body? And those patients aren't sick, and they don't need surgery. But
right. But is this necessary?
As much as any plastic surgery. If it's causing the patient some psychic pain, if they feel ashamed, if they feel loss of self-esteem, if they feel unhappy, or if they have a medical problem where they actually, have trouble with intercourse because of the redundant labia.
Does that happen?
Yes, absolutely. Women report that they have to roll it out of the way during intercourse. And if those are the cases, if patients feel that, then yes, they qualify for the surgery.
Now this procedure, where is it done? What about are they out completely? What's the downtime?
It's actually very similar to the laser vaginal rejuvenation. It's approximately 1 hour outpatient surgery, general anesthetic, and it's not very painful. Patients get ice packs and some oral pain narcotics, and they do very well with it.
Why did you pick to do this surgery? Of all things, I mean, you're a urologist. I guess you've done 4,000 genital surgeries, but why this?
These patients are just as happy as the other ones who had functional problems with hernias and pelvic floor problems and incontinence, and
so you think
they
it's
deserve
ignored?
it also. Yeah, it's ignored. Why shouldn't they have a chance to receive treatment if they wish to have it?
Is this an easier, less technically demanding than the tightening procedure? And could they both be done at once?
Actually, that's a good question, Randy. A lot of patients do have both done at the same time, and it's very simple to combine the procedures, and we do that commonly. Also, these procedures can be combined with other cosmetic procedures.
Like?
Some patients have a little bit extra fatty tissue in the mons, the area, the little fat pad right above the pubic bone, and some of them need liposuction. Some of them need or wish to have breast implants. There's a lot of, I think approximately 15% of the laser vaginal rejuvenation procedures are done in conjunction with another cosmetics procedure.
Now, off camera, you speak, very strongly, compassionate, much more than you are on this stage, and you say that you have a bias, that you believe that if you're going to do it, if a woman's going to do this, that it should be done by a laser, and with the specific training and the guy that you learned from. Tell me about that.
I understand the other procedures that are being done out there. I understand, that patients can get some benefits, but if the patient wants, the best outcomes, superior safety,
best measured by visual aesthetics.
In the case of the vaginoplasty, yeah.
Okay.
Then they should do their homework. Get on the internet, look up the Laser Vaginal Rejuvenation Institute. Look at all the sites around the world where they're doing the exact same procedure, trained by the same guy in the same way. He's done it over and over again because it works, and it looks nice, and it works well for people.
Now, you say it's a popular procedure. What do you think is driving it?
It's multifactorial, Randy. There's some changes in the way women do their personal grooming. There's some changes in fashion. Bikinis are different than they used to be years ago. And there's knowledge out there. People are watching TV shows like 90210 and hearing about this. And they're getting on the internet, and people have access to so much information on the internet now. So there's this awareness with this ability to obtain education, and there's in general a little bit of a liberation in women's sexual behavior, and mores are loosening a little bit, and people are feeling more comfortable talking about this sort of thing. And it's an opportunity for people who have difficulty with this to get help. Are you criticized by their physicians that you're doing this? Or will you be, in your opinion? I feel that I'm well respected in the community. I haven't had a single physician walk up to me and say, what you're doing is wrong. I don't believe in it. I think this is a bad idea.
And it is your place as a urologist, you believe?
Oh, absolutely.
To do this.
I think I'm eminently qualified, you know, based on my pelvic floor surgical experience. But, you know, I feel that people are aware that it's an issue, but I think a lot of physicians would like to do this, and we're probably a little bit afraid of maybe what their colleagues might think of them.
What are their fears about the procedure?
I think the number one fear is pain.
Okay.
And you know, we try to alleviate their anxiety by explaining how we use the pudendal block, which gives 24 hours of postoperative pain relief. And a lot of patients are afraid of scarring and disfigurement, and you know, that's something that we can help them deal with by showing them before and after photos. And a lot of patients are afraid perhaps of what other people might think of them if they have this surgery, what their husbands might think of them in many cases, if it's, you know, they feel like they need to explain it and get permission, and fortunately most of the husbands are very supportive.
The consultation, you're not charging for consultations?
We offer a complimentary consultation.
Okay. So find out where you stand, and if it bothers you, do something about it. Is that your message?
Yeah, we want to make it easy to get access to us, to talk to us, to learn what it's all about. And as I said earlier, the patients who need it, they know who they are. We're not trying to go out and find people for this procedure. We just want to be there for them.
And if they call, they speak to a woman?
Absolutely.
Is that right? Okay.
Yes.
Well, thank you for coming to the show.
Thank you very much.
Thanks. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.